Hey guys, good evening. So we continue with the homework given yesterday. This is the same thing but directed to this is a home health nurse's letter, and then we have another one that is going to be directed towards the occupational therapist, right? So let's check this one, and then we'll check the occupational therapist letter as well. And all the letters that has been uploaded as part of the homework will be individually checked and assessed. All right. So there's nothing wrong with the format. Let me tell you that some candidates they prefer to write the date here. That's acceptable without any problem, right? So I'm writing to discharge Mrs. Cindy Shaw. That's not a discharge. You are still referring, but the patient is getting discharged. You're sending to a new person. That's always a referral. A 75-year-old hyphenated. This one you would hyphenated. This is wrong. Come on, women is plural, right? Admitted with left hip replacement following fracture sustained after fall requires future ongoing assessment. Correct. Ongoing assessment. Do we need an assessment? No, we have to be precise. We exactly want a home visit from the nurse, isn't it? So why not to say directly what we want instead of beating around the bush? Miss Shaw was hospitalized on 23rd September 2018, who was diagnosed with diabetes mellitus for 20 years. Okay, since 20 years of age. No, that's wrong. It doesn't say anything about since the age of 20 years, but instead says that it's been 20 years. 20 barsa, 20 sal, bio. That's what it's saying. So what you've made it look is that when the patient was 20 years old, that is the time when the patient developed diabetes. But that's not the truth. It's been 20 years since the patient had diabetes. That's a different story. She was on pre-course with 25 mg. No. Um, However, after post-operative, what do you mean by after post-operative? However, after, why is the after A capitalized suddenly in the middle of a sentence? After post-operative, you cannot write like that. After already means like post-operation already means after. I don't know. Why do you need to double enforce? After pani post pani duitako meaning every. So after operation, her mobility was decreased. No, had decreased. Her previous medication for diabetes was increased with 50 mg. If you're writing increased with 50 mg, that means 25 plus 50, it becomes 75. That's wrong. Diabetes is D is going to be small. Was increased to 50 mg. That's the thing that you need to write. Due to stress? No, it's not stress. That's wrong. That's because of stress, hyperglycemia. In addition, comma, her incision site was slowly healing. That means okay, and staples were removed in. No, we do not need in. Staples were removed 2 weeks on after 2 weeks on October 9th. Oh, sorry, how is that possible? We are still in 28th September, and you're saying that the staples were removed. Custody possible. Do you understand what I'm saying? The day on which you're writing the letter is 28th September, right? And the staples are subjected to be removed on October 9th. Which one comes first? September or October? September. Then how can you write this? Staples were removed in 2 weeks. No, no, has to be removed or will be removed. Moreover, you cannot use moreover, furthermore, besides in OET writing, and also so. Her pain level was described. No, 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 no. You have not. Whatever you've written in the second paragraph doesn't make sense. Wait. Let's see the other letters. Yeah. We had talked in great deal about this letter yesterday. Please check the recording again. Wait, home health nurse, and there was another one. Wait, let me check. Okay, now the same thing written to occupational therapist. When we write the same thing to the occupational therapist, what happens? See, everything is good here. The format's fine. I'm writing to refer Miss Cindy Shaw, a 75-year-old. Hyphen placement also has to be between year and old. Was recovering after a left hip replacement surgery. Requires home assessment. Assessment was spelling wrong. And management following her discharge today. Yeah, please be. We don't. Yes, that's home assessment is absolutely correct. But the letter that we checked from formally, there was a mistake because we were asking the reader of the letter to visit the patient's home. Right here, the spelling is wrong. Okay, Miss Shaw was admitted to hospital on 23rd September 2018 with sustained fracture. No, no. With is already doing its job. Or after sustaining a fracture, you need to write in that way. Following a fall for which she underwent the procedure. Okay, after post-operative. No, you don't write after post-operative. Post one, okay. What is the meaning of post? Post means already after on the, and why to add after on top of that? It doesn't make any sense, isn't it? So post-operatively, why not you start like that? Or write, if you really like post, then write post-operation. Okay, post-operation or post-operatively or after the operation. Now you choose which one you want to do. She was hyperglycemic and manage he. What do you mean by manage he? The patient is a she. How come he pronoun is there? Moreover, she was provided with compression stocking. No, no. You're writing to occupational therapist. So you're asking for home assessments. You need to give the reason for the home assessment in the second paragraph. We're going to talk more. Let's see other letters. Um, the Poonam's letter. See, the second paragraph of the letter should be the exaggeration. भनेपछि इन्ट्रोमा जे लेख्यो त्यसैको प्रुफ हुनुपर्छ सेकेन्ड प्याराग्राफमा. If you're asking somebody to for home visit, then you have to give the reason why that particular person has to come to your place and do the home visit. And if you're asked somebody to come home and assess the living environment, then you need to give the reason why. So the secret in this letter is that the patient's daughter and son-in-law, they are not going to be taking care of him anymore for a period of 1 year. And since it has just been few days after the surgery, there won't be anybody at home who will be taking care of her, right? So home visit nurse is going to make sure that the dressings, the staples, the pain, and all the medications, they are continued as told on the discharge sheet, right? And what is the job of the occupational therapist is that occupational therapist is going to come to the new home and make sure that the living condition is suitable or not. What is the job of the occupational therapist? Like, for example, if the bathroom is slippery, if the tubs are slippery, if the stairs are slippery, if there are any railings in the bathroom for the patient to hold while taking shower. What if the home health nurse or even the occupational therapist is not going to be with the patient all the time? The patient is going to be by herself after the discharge. What if she slips while at home? हो यो कुराहरू प्रिभेन्ट गर्नलाई, to prevent these things, the occupational therapist is going to visit. So you need to tell that in the second paragraph. So when you write to different professionals, the content of the letter immediately changes. Yeah, I hope you understand. Let's see this letter. It is your responsibility to add Miss, Mr., Mrs. in front of somebody's name as a salutation. Claudia is clearly a female's name. So you write Miss Claudia Mayhem. All is good. Date format is correct. Contrary to the last letter that we checked, uh, we checked the last letter. The date was written above Claudia, right? And this is also another accepted format. Okay, I'm writing this letter to discharge Miss Cindy Shaw. No, 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 no. It's going to be refer a 75-year-old patient who was admitted 5 days ago for a left hip replacement following fracture sustained after fall. Correct. She needs further management. Okay, makes sense. Why would we not talk about? I'm quite surprised here, Sipunam. I mean, why to hide the secret? We're asking the occupational therapist to come and visit the living condition and assess the living condition in the new flat where the patient is going to move. Why are you talking about further management and ongoing support? Clarify that. Yeah. Miss Shaw lives with her daughter and son-in-law, but her daughter is leaving overseas next week for a year due to her husband's job. The main concern is that she's going to move into a self-contained flat and needs to do all her routine activities independently. Perfect. She has been able to walk with the help of a walker, but she was diagnosed with diabetes mellitus 20 years ago, for which she received Preco's 25 mg, and now it is increased to. Are you telling this? Why are you telling this? Maybe you can throw it down in the third paragraph, but why are you talking about Preco's 25 mg that has been increased to 50 mg? What value does it have to the occupational therapist? Talk. What are the current capabilities of the patient? She's able to walk 50 to 60 steps, yeah, with a pain of described as 5 by 10. And later on prolonged walking, it becomes 7 by 10. Yeah. These are the things that you need to put in the second paragraph. We don't care about. We can mention the okay, see, she has diabetes, but the dosage and everything, that's not very important. It has no value literally to the reader of the letter. During her post-operative stage, she described that her pain was this during her post-operative, okay, and increases after walking up to 72. What do you mean by this? During her post-operative stage, she described that her pain was 5 by 10 and increases after walking up to. Why not to mention how long does the patient walk, or prolonged duration up to 7 by 10? She was advised, remember ADVIC, C form is never going to have ED. C सँग कहिले पनि ED लाग्दैन, S सँग लाग्छ. So she was advised ADVI for moderate mobility with the help of walker, and really dressings were done. So you can write in the second paragraph, the walker has been suggested for the patient for mobility, and she's able to do all her activities at the moment by herself, although there is a role of pain. She has a bit of pain while walking for a prolonged period that she describes as 7 by 10. Even for normal walking, the pain is 5 by 10, right? You write like that. After that, tell the main concern, go and check the house and see if everything is suitable or not. And let me tell you something else. You can talk about the what were those things? The things those the articles that was purchased by the daughter. You can put that in the second paragraph as well. That will be the concern of the reader of the letter. But I mean, if you just mention that the daughter is leaving abroad and there will be nobody taking care of her, and she'll be living on her own, that's already enough. We do not need to talk about the precos and medication in the second paragraph. Regarding the discharge plan, she requires, yes, this and balance for weak arms and to decrease the risk of falling. No, instead of since she will be living alone, a complete, yes, this is the one that we need. Exercise is not the concern. We can say that her upper extremities, she has weak arms. Regarding the discharge plan, it is important to note that she has weak arms, so weak arms, therefore extra attention has to be provided since she will be living alone. Not living भनेको छोडेर जानु होइन र, living alone भनेको अहिले बसिरहेको LIVE हुन्छ नि, त्यो leave हुँदैन, leave भनेको छोड्नु. A complete home hazard assessment and occupational therapy has been recommended. लौजा अरे occupational therapist लाई नै लेखिराख्नु भएको छ नि, why are you saying that occupational therapy has been recommended? Since she will be living alone, a complete home hazard assessment from you is recommended. So a sock and shoehorn, reacher, dressing stick, and raised toilet all have been हुन्छ नि, धेरै कुराहरू छ नि त. Have is a plural form of has, purchased by a daughter and needs help for the cost of non-slip mat for bathroom and rails. That will be covered by the daughter herself. So लेख्दै हुन्छ त्यही कुरा. She has been recommended to show her. She has been recommended to shown. She has been recommended to shown how to cook. Okay, ठीक छ. Cook meals using reacher with no bending where placement of food. Okay, makes sense here. Yeah. Change a little bit, change the diabetes part from the second paragraph. We will have a little bit of space. We'll have one line, maybe add something else. You can talk about this during her post-operative stay, the pain that you've described. You can merge that with the former paragraph at the top. Discharge plan is all good. Change the sentence structure when you're already writing to an occupational therapist and you're saying that occupational therapist is recommended. Milan Just change those places and it's all going to be fine. Okay, let's check the other two letters. Okay. Okay, this is another version. So we have checked Swastika sister's letter. We've also checked that was Poonam's letter. Now we have this one's I think Sony Sonisha sister's letter. Yeah, there you go. I'm putting it on the screen. Please note down whatever I say. Okay, all good. You cannot use age there in RE part. I've never taught this before. Maybe you've watched it in the video, I don't know where, but since 2022, the age part has been removed from RE part. And name and age or name and date of birth should not be separated with a semicolon, but instead with a comma. Yeah. And let me tell you that capitalization is also an issue um, when you do writing. Make sure that you know the S and the P and everything that you write. For example, park is somebody's name, isn't it? So you need to keep it capitalized. The one that you've written is considered small, remember. Miss Cindy Shaw, C also has to be capitalized, S has to be capitalized, and don't write age there, please. That place is booked only for date of birth after 2025. I'm writing to refer. Now, why is W capitalized? Miss Shaw, who had underwent a left hip replacement following fracture and is being discharged today, and is being discharged today, he requires. How come it's a he? It's a she. होइन र माथि मिस लेखेको छ. How did he write? Why did he write he? Note it down. There's a sex change in your letter. She requires further home care and management from your service. No, that's wrong. Oh yeah, that's correct. Sorry. I thought it was to the occupational therapist. Correct, makes sense. Ms. Shaw was admitted on 23rd September with sustained fracture following a fall, for which she underwent the aforementioned procedure. She has been diabetic for the past 20 years. What's that? It's a comma or full stop? I think it's a comma. That's wrong. Put a full stop there. Because the P that you've written is small, you have to make it capitalized. Put a full stop after 20 years. Post-operatively, she was encountered with stress. Not she was encountered, she encountered me. She was encountered means अरू कसैले encounter गराइदिएको. Remove that was from there. She encountered with पर्दैन stress hypoglycemia with fasting this. And then hence both are connectors. You choose one. Hence गरिदिनु. Hence 2 units of insulin given and was given. Currently you're fasting what? Fasting sugar is this, and PP you can expand that, and needs to monitor 2 times per day. Okay, so the first part is correct, despite few errors. Then post-operatively SP, she encountered stress glycemia with this value. Therefore, insulin had been given along with the increment or increase in the dose of precos from 25 mg to 50 mg. Write that. She is currently stable, or today on assessment, her blood parameters, her blood sugar level is stable, therefore fit for discharge. That's the way you write there in the second paragraph. Give the reasoning, that she had all these things. Initially, it was deranged, later it got better. Miss Shaw showed good prognosis after surgery. Has shown unja. Showed means she doesn't show anymore. Her incision site is healing slowly and daily dressing is required. She has been encouraged to perform ROM and strengthening exercises. However, scar tissue massage was suggested only after incision heals. Has been suggested. She can resume mild exercise after 12 weeks after review by physio. Please note her staples needs to be removed. Need to be removed. अनि यो लेटरमा अरु खोइ त नि पेनको स्केलहरु. You have to tell that the patient has considerable difficulty while walking for longer distances, where the pain is around 7/10. Normally, also she has pain at the level of 5/10. Where are those things? You have not mentioned. The letter becomes short. Okay, it would be greatly appreciated with spelling wrong, sir, if you could assist with her health status as she will be living alone for 1 year. 1 year नहीं हुन्छ र कहिले एक वर्ष 1 year मात्र हुन्छ. You need to tell in the second paragraph, that why you're exactly asking for a home visit because she's moving to a new self-contained flat after her daughter and son-in-law moves abroad for a period of a year. You need to include that. You need to talk about the current capabilities of the patient, weak arms, and then the pain she experiences while even doing the activities of daily living. Not to forget the fact that if the patient walks for a longer period, the pain exacerbates or worsens. Big pain अझै नराम्रो हुँदै जान्छ. You need to add those things in the second paragraph. त्यो पुगेको छैन यसमा. The content is missing. All right. It's a good try, but we still have problems. We are going to rewrite the letter. Everybody's going to rewrite the letter. Miss Claudia Mayhem, all good, all good, all good, all good. You cannot write the age there in RE part. Let me tell you. Date of birth only, age moved to the intro. I'm writing to request home assessment and management for Miss Shaw. She underwent left hip yes, correct. Miss Shaw was admitted on 23rd September and underwent the aforementioned my single F huncha. Surgery. Post-operatively, P has to be capitalized, otherwise it's going to be considered small. And I imagine what the little dot that we have after surgery is a full stop, not a comma. If it's a comma, it's a blunder. Put a full stop and then start the sentence again. Full stop लगाएर नयाँ sentence start गरिदिनु. Comma हाल्न मिल्दैन because there has to be a connector between between surgery and post-operatively. Post-operatively, she has shown, or she showed good progress. She can walk 50 to 60 steps with the aid. However, complains of pain after walking for 5 minutes. Yeah, which she describes as 7 by 10. Oh, you add गरेको राम्रो. Now, why does Miss Claudia Mayhem, why does she have to go to the patient's home? You have to describe that, she's going to live in, okay, you've written it here. Miss Shaw is set to move into a self-contained flat from 4th October as her daughter is leaving abroad. Since she will stay alone for a year, a complete, yes, makes sense, is significant. Good. Subsequently, flat assessment is necessary to check whether the steps are suitable for walker or not. Very good. In addition, discussion was made with Miss Shaw regarding non-slip mat for bathroom and rails. Her daughter has already bought, spelling galti pani sister, bought sock and shoehorn, reacher, dressing, and raised toilet. Take to a toilet razor. It would be greatly appreciated if you train her to cook and using reacher. Please make sure she don't do that. She doesn't perform. No, 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 that's wrong. Closing is usually just 20 words. You don't have your closing should not be very long. Why don't you attach this? Why don't you merge that as a discharge plan? And in the closing, you just write simple things, just a one request. It would be greatly appreciated if you train her to cook and using reacher. Done. Full stop. And please make sure she doesn't perform any bending activities, and hence assessment is required to keep food item within her reach. Keep it up. One request at the most, not more than that. Don't complicate your closing. Conclusion means you just need to write. There has to be one ending. कुनै पनि एउटा मुभीमा एउटा एन्डिङ त हुन्छ नि. दुईटा तीनटा एन्डिङ भएको देखेको छ कहिले मुभीमा? No, right? So just keep one request towards the end. This is well written. This the third page. This is not bad. Yeah. Okay. The other letter slightly compromised. Okay, let's see the other letters. Where are the other letters? Please submit your letters. Homework. Please upload your letters. This is the end of the chapter. We're not going to discuss this letter in tomorrow's lesson because tomorrow is going to be another topic. I'll give you another homework. I'll check the rewrite separately, but if you don't get it evaluated here, there's no point. You have to do the homework if you're told to do the homework, or what's the use? Yeah? Okay, let me again tell you how it is done. Yeah? Some of you have kind of like, let's say 75% correct, not 100% correct. It's not bad at all. Let's try. I will write a little bit and try to understand. And then we're going to go into the speaking. I imagine you guys have not done the homework, some of you. I'll give you another homework for tomorrow. All right. So introductions is fair and square. Nothing special about the introduction of the letter. You all understand the introduction of the letter, because in the introduction of the letter, what is going on with the patient is same, no matter you write to an occupational therapist or you write to a nurse or you write to a doctor, it doesn't matter. The second part of the letter is just basically the copy paste from the writing task that is at the bottom of the letter. Now, the second paragraph is the thing that varies depending on who the receiver of the letter is and the overall content of the letter. In the discharge plan, we don't talk about medications and all those things. So what I'm writing at the moment in the second paragraph is for the nurse. So try to note it down, or try to memorize, and this is the lesson for the future. Okay, here you go. Miss Shaw underwent a surgery after a fall injury that led to fracture. Fracture. She has been managed. She has been managed for 5 days after the surgery. She has been managed for 5 days after the surgery, where received pain management with Vicodin. Vicodin. It is noteworthy, or please note, it is noteworthy that her sugar level, or she had stress glycemia that resulted in values of HbA1c and PP, right? It's given there. You can just copy paste. Therefore, she received insulin infusion along with her glucose medicine, whose dosage was double two, double two. Value day at the time of discharge. Yeah. Is under control. Sorry, under control. You have space. Under control. The main concern is that husband are leaving or receive caregiver. Therefore, crucial. Miss Shaw is capable. Miss Shaw has had a steady recovery, evidenced by her increasing NDEP and DE independence, where she is currently able to she's currently able to mobilize and do her activity on her own with pain rating of 5 by 10. However, however, she prescribes increase in pain flat is moving very new to her. New things differently provided. Provided here regarding the future plan. And then you can just copy. Yeah, this is the basic content. This is the way you write. You know, I've of course written in my own way. Of course, you can memorize a few patterns, right? Future plan. What do we have? Monitoring the medication, and we have stitches removal. Then we have, the placement of food. She has to be taught about where things and food should be kept. So basically, you're going to copy, paste, and expand. But the second paragraph is crucial when you do this kind of writing. It's so important to describe the current status of the patient in the background of whatever has happened to the patient, right? Now, this is your when you write to a nurse. When you do the same letter to a occupational therapist, what is going to change? So in the introduction of the letter, you do not need to necessarily keep everything in suspense. If you are asking the occupational therapist to come and visit for home assessment, just don't feel shy mentioning that. You know, the more direct you are, the better it is. Now, the second paragraph that is important for, since we are asking for home assessment, we have to describe, first of all, the reason why home needs to be assessed in background of whatever is going on with the patient. So please, so who wrote? Poonam, you've written that, the pre-course dose had been doubled from 25 mg to 50 mg, right? That is no point. There's no point writing that in the second paragraph. Everything that you write in the second paragraph when you are directing the letter towards the occupational therapist has to be related to home assessment. Related to occupational therapist. So check this out. The second paragraph for occupational therapist. Ms. Shaw underwent a successful procedure after she had a fracture of the hip. She was hospitalized, or she was subsequently hospitalized on 23rd. See, different ways to express yourself. September 2 or till today. Yeah. Where her progress seems satisfactory. Satisfactory. Yeah. The main concern is that her daughter, with whom she lives currently. It may take her a different way, Max Rescarico. Currently won't be available. Maybe available for care for a year duration and post-operation and after and post-operation, or for a year duration won't be available for her care for a year duration, as she, along with HUSB and the husband, are leaving ABL already abroad. Yeah, abroad. Therefore, she is being. I'm very bad at typing. Please excuse if I'm making any spelling error. She is being shifted. Message shifted to a new flat where she will be. We have already done the where thing, yeah. Flat where she will be living alone. Please note, considering her current pain level while doing her daily activity of 5x10 and 7x10 on exertion, her home warrants मानेको needs नहीं हो, needs to be assessed. New flat. Yeah. What are the other things that we can note? We can write. Yeah. We could change the paragraph. We've written many words. Try to keep the body paragraph no longer than 80. So in the next paragraph, you can straight away go to the plan, regarding the future plan. Yeah. Or you can also write, please note, considering her current pain level while doing her activity on exertion and upper extremity weakness. You can also add here, upper extremity weakness. And upper extremity. Goodness, what happened here? Weakness. This already got it into. Yeah. If you think it's too long, remove the upper extremity weakness and put it somewhere else. Then you can go straight away go to the discharge plan. So the daughter has already purchased all the things that has been recommended. She's going to be paying for her Then food placement has to be shown, and then we have to make sure she has to be taught and all these things. So remember, when you write to a non-medical professional, usually the letters are short compared to when you write to a medical professional, such as nurses and doctors. Yeah. After this, directly comes a discharge plan. We do not need to be particular about the Vicodin, or we do not need to talk about mm, what is it called, precourses dose being doubled, because that's none of the concern of the occupational therapist. However, in the discharge plan, you can also say that she's permitted to do her activities in 15 days. So home assessment and home environment has to be double checked. Yeah, conducive is the word. Conducive means suitable for living. Yeah, note it down and memorize. If you ever see any letter that is directed to occupational therapist, that's going to be your second paragraph. If you like a certain way in which I write and describe the letter, memorize the sentence structure so that you can use the same sentence structure while writing the other letters. Okay? Let me know once it's done, please. Yeah, done, right? Okay. So I'll remove this from the screen. There you go. Still, if you have anything, done anything, the homework, please send it on the group. I will check it. If not, we're going to proceed towards the speaking. Yes? So we had done a bit of speaking yesterday, and we're going to continue the same speaking now. I hope you have prepared that. And I want to also know if you have memorized the criteria that I talked about yesterday. All those A1, A4, B1, and all those things. Same speaking. I wanted I want you to do it well. Yeah? Okay. So let's see who's going to start. Poonam, you didn't do it yesterday. Where's Poonam now? When it comes to speaking, everybody runs away. Okay, she has run away again. Let's see. Who's going to do it? Swastika, you can do it. I'll give you 3-4 minutes just to recapitulate, and then we'll continue with the speaking. Sumnima, you're going to do it as well. Sony, you're also going to do. Swastika,
Okay.
take 2-3 minutes, everybody, to revise whatever you prepared from the link that I had sent yesterday. We had discussed about this in the class. I don't expect like full 5 minutes, but at least even till 3 minutes, you're good. I'm good. So, all right, 3 minutes, 3 minute 19 seconds. We can start. Who's going to start? Let's see. Swastika can start.
Shall I start now, sir?
Yes.
Hello, good evening.
Hello.
My name is Swastika Chan and I'm a registered nurse in this hospital ward. So, from the case note, I came to know that you are diagnosed with the hyperemesis gravidarum. Is that correct?
Yes.
Okay. So, Miss Julie, first of all, I'm really very sorry that you are diagnosed with the hyperemesis gravidarum. You look a bit concerned. Is there anything bothering you?
Yes. What is going on with me? I don't understand what is happening to me. I am so worried that something bad is going to happen to me.
Oh, mm-hmm. So you don't have to worry about that. We are doing our best to uh, manage you. So please don't worry. Okay, Miss Julie.
Okay.
Okay. So so I would like to know that. I would like to know that from when did you experience vomiting?
It's been going on for 3 or 4 days already.
Okay. So do you know about hyperemesis gravidarum?
No. Date so this hogi. No, I don't know.
Okay. Hyperemesis gravidarum means that it is an abnormal condition for pregnancy associated with the prolonged vomiting, uh, weight loss, and a fluid and electrolyte imbalance. But you don't have to worry about that. We have already given you IV therapy and a complete bed rest and IV paradoxin. So, are you getting me?
Yes, I get that. But what about the medication? Is it going to do something bad to my kid?
Oh, I'm I'm so glad to hear that you are worried about your baby. But but this IV therapy will not harm your baby, so you don't have to worry about your child. So according to the doctor review, uh, I came to know I came to know that you you don't have a severe your case is not severe and it will recover fully. So you will deliver a healthy baby. Are you getting me?
Mm-hmm.
Okay. Would you like to see your husband, Miss Julie?
Yes, why not?
Okay. So he is waiting in the restroom so that you will get emotional support from him. Uh, okay. If you have any queries uh, regarding your health issue, you will have a anti drop for at least at least at the end of your trimester. So if you have any queries regarding your issue, you can please contact me. Thank you.
Yeah, you still have a minute left. You need to reassure the patient when you still have time, because if you finish, it's never a guarantee that a 5 minute speaking is going to finish exactly at 5 minutes, like they show on many videos on YouTube. because they are practiced, they're pre-practiced, right? So you can finish at 3 minute 50 seconds, you can finish at 4 minute 20 seconds, 10, 15 seconds doesn't don't matter. But if it's this much, of course, there's going to be penalty. Right? So you need to learn how to give reassurance towards the end, you know. So do you have any questions? Is there anything else that is bothering you? Was I able to explain you everything? After that, uh, give a bit of reassurance. How? I know, Mary, I know, Julie, whatever the name is, you're concerned. Of course, any mother would be concerned for the well-being of the child. But I've already told you that the medication that has been provided to you are absolutely safe. And uh, very rarely, few women experience excessive hyperemesis gravidarum. That means excessive vomiting. And this is happening to you at the moment. But we have already put you on the therapy. You are going to be fine. Something like that. And for now, try to rest as much as possible until I send your husband here. And if you have any questions or any worries, you can always ring the bell. I'll come and help you. That's the type of kura garra. You have to kill the time. Yeah, we could have done a better B1. B1 and B3 could have been done better. Let's see who's going to do next. Sumnima, you can. Sorry, Sumina. You try. I'll tell you how to do it properly. Don't worry.
Start, Gaurav.
Yeah, you can start. Go.
Hello, good afternoon. My name
Hello.
is Subina. I am attending nurse today. How are you feeling right now as your diagnosis with hyperemesis gravidium?
I don't feel good. I don't feel well, and I'm very anxious. First of all, tell me what is this condition? Does the word itself sounds very scary?
Okay, don't worry. Please just relax. I will explain you everything. Hyperemesis gravidium is a abnormal condition of pregnancy. When you have prolonged vomiting, weight loss, and fluid and electrode imbalance. It's called hyperemesis gravidium. Okay, and
Okay.
in your case, it's not serious. Doctor has already told you, like, right now you are in a IV therapy and complete bed rest. In a couple of days, you will recover fully, so you don't have to worry. Is that okay?
No, I'm quite concerned about the medication. What if the medication that has been given to me is going to harm my child, you know? And
Okay.
I'm seriously concerned about the well-being, and I've been vomiting excessively. I'm also worried about this.
Okay, I can understand your concern, but I reassure you, I can assure you that the given medication is totally harmless. It will not do anything bad to your baby and you. And after it will not harm your baby. You will fully recover and you will deliver a healthy baby later. Okay.
Hmm.
Is there anyone with you that I can call?
Yes, my husband's here with me.
Okay. Then I will call later. I will call your husband to see you. Um, is there anything you like to ask me? You like to share with me?
No, nothing at the moment.
Okay. I can understand your concern, but let me assure you that the given medication is totally harmless and it will benefit you. It will not harm your baby. After you discharge from here, you fully recover and you can deliver your healthy baby. Okay.
Hmm.
Okay. Thank you. That's
You still have 2 minutes left. You have to talk about the
2 minutes.
reassurance.
Oh my God.
You need to do the reassurance. You know by yourself that you finished early. It's fine that you're doing it for the first time. It doesn't matter, but you must be aware that, there are 2 minutes still left and you have to kill the time. And I have already told how to kill the time. You have to repeat most of the things that you've said and give a little bit of extra reassurance to the woman who is pregnant, right? And you need to also tell the patient that, it's a common condition, it happens in pregnancy, and very rarely some will experience excessive vomiting that you have been experiencing. With medication and proper care, it can be controlled. Give a little bit of reassurance and make the patient feel that, okay, malakipin bago, it's a normal thing and it's happening just a little bit more to me, but I'll be fine. You have to give that confidence to the patient. You're not giving that. Another problem is that you're not doing your B1. I hope you've memorized what is B1. B1 means you have to construct few questions on purpose to show that you are giving interest in patient's condition. So if B1 means, so since when have you started experiencing hyperemesis gravidarum? When you start a question with when, it becomes an open-ended question. And what OET suggests, according to the criteria D2, that initially you should be using more open questions compared to the closed questions. Of course, it's not a sin to be using closed-ended questions also, but you have to demonstrate in your speaking to the assessors. You have to convince the assessors that, see, I'm using open-ended questions. When did you first start having this? How many times have you been vomiting? Feriarco, this is also an open-ended questions. Okay, have you taken any medication prior to coming to the hospital? See, these kind of three questions we have generated, two open and one closed. That means we're showing chaso, we're showing interest to the patient's concern. That is called B1. Then you need to give B3. B3 means, so it's already given there. B3 is already written there. You're very lucky that it's an electrolyte balance and blah, 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 blah. But you need to add reassurance to it, saying that, it happens, in first trimester too. Almost all the women, and some of them have vomiting in a bit excess. But you're at the right place. You're in the safe hands. We are a good medical team. We're going to take care of you. We're going to handle you. And you're going to be absolutely fine in a day or two to come. So don't panic. And yeah, it's a valid concern about your baby. Yes, as a mother, I know that you're worried, but let me assure you that the medication that is being provided to you are pregnancy safe. The doctors and the nurses and the medical team here are very experienced. We will never take any risk on you nor your child. This kind of things has to be added by yourself. So OET speaking is all about, if you're doing OET nursing, you already are a nurse. And imagine that if this situation really happened in a clinical setting, then how will I speak? How will I react? And then add a little bit of OET elements to it. And that's going to make things easier. Another important one is E1 that you need to do. E1 is, do you know what hyperemesis gravidarum is? That means E1 says, asking the patient if the patient knows about his or her own condition. Do you know what hyperemesis gravidarum is? If you construct such question, you're also going to score from E1 of the clinical criteria list. There is another one that is important, that is C2. C2 means, okay, let me tell you more about hyperemesis gravidarum. Let me tell you this, let me tell you that. When you start any sentence, that's called signposting. You should also be scoring from there. So this current, Sumina, the problem that you have no B1. You did the B3, but B3 doesn't have any assurance or reassurance. You need to add A4 to it. You need to add E1 to it. And you need to also add E4 to it. E4 means, are you getting me? Are you understanding me? Are you following me? These things have to also be added in the middle, right? Okay. Check those criteria that I've told you just now. You have to memorize them. Okay, let's see who else is going to do it. Sonisha, you can try. Just be a nurse. You don't need to do anything special. With practice, it'll automatically come to you. Just ready, go.
Mm, Good afternoon.
Hello.
My name is Tanisha, and I'm one of the registered nurse working in this hospital ward. So, just for my confirmation, can you please tell me your name?
You don't need to ask name for the admitted patients, but still, okay, my name is
Okay,
Mary.
okay, Mary. Okay, Mary, I can see you upset. May I know what's bothering you?
Yes, I've been vomiting a lot, and I've already been told that, I have some weird name condition, something hyperemesis. What is it? Can you tell me? What does that do to me and my child?
Yes, Miss Mary, I can understand your concern, but don't worry. Hyperemesis gravidum, I will definitely tell you about this, and it is just a condition that's associated with pregnancy, where you can feel like prolonged vomiting, weight loss, and also fluid and electrolyte imbalance. So this kind of symptoms that you really generate during your pregnancy period. Okay. And also, Miss Mary, in your case, it's not a severe, and you don't need to be worried related to this condition, as your case is not severe, and you will gonna recover fully, and you can have deliver a healthy baby. So is that all right?
Yeah, what if the medication that is being provided to me will do some harm to my child? What if my child's life is at risk, and what about me?
Miss Mary, I can acknowledge your situation, but if I were in your place, then I would have feel the same. But don't worry. As the medication we have using on your case, like pyridoxine medicine, yes, that's for severe vomiting, and this kind of medicine is totally safe. And let me reassure you that the medicine we have been using on your case is totally safe, and it will not harm your baby. So you don't need to be worried about these things. Okay.
Okay, so how long do you think this discomfort is going to last?
Mm, Miss Mary, I can, your concern is reasonable. So this kind of situation, means this kind of symptoms that you are been facing is for a certain period of time, as usually in pregnancy, like within 20th semester, usually in pregnancy, these kind of symptoms can be seen. So in your case, you will soon you'll soon recover, and you will deliver a healthy baby. So you don't need to be worried, and don't take much stress. All right. So Miss May, who are you, like with
But
you? Who are you with? Like anyone with you here? Or
yes, it was my husband's here.
okay, okay, Miss Mary. So that I will call your husband, and so he will be near to you just for an emotional support. And again, I just want to tell you that just don't stress yourself. Take rest, and you need a full, complete bed rest, and your concerns like with your baby and medication and these things, you just don't need to be worried. Your your machine that we have been using is totally safe and will not harm your baby. All right.
Yeah, okay.
Okay, Miss Mary. So now you just take rest. As I told you earlier, that you need complete bed rest, and and continue with your medicine. So if you need any kind of help, or if you want to ask anything, then you can just call us. You can give us a buzz, and we'll be right here. All right.
Okay,
Take rest. Have a good day.
good. Very nice. Take some.
Thank
10 seconds left. It's not a problem.
you.
Yeah. What I suggest you at this point, you're doing it for the first time. It's bravo. Very well done. Check the criteria. Yes.
Mhm.
A1, A4, B1, B3, C2, E1. You have to anyhow memorize, and you have to make sure that these criteria are there in the initial 3 minutes, and the rest of the part, it's always going to be smooth.
Okay.
Well done. It's not bad. Let's see. Kalpana, you can try. Kalpana?
Yes, sir.
Yes. Let's start.
Hello, good afternoon.
Hello.
My name is Kalpana. I'm one of the registered nurse in this hospital ward. May I reconfirm your name, please?
Okay. My name is Mary.
Okay, Mary. Um, according to your file, I know you diagnosed with hyperemesis gravidum. Do you know about
No, I was actually meaning.
hyperemesis gravidum?
I was meaning to ask you about this. What is it exactly? I'm so concerned about it.
Okay. Mm, hyperemesis gravidum is an abnormal condition of pregnancy associated with prolonged vomiting. Mm, due to vomiting, weight loss, and fluid and electrolyte imbalance.
Hmm.
Are you getting my point?
Yes, but what is the implication of this thing on me and my baby? I'm so tired of this. I've been vomiting relentlessly.
Okay, I know your okay. Don't worry. I know that your concerns, but I know your concern. You are in hospital, so don't worry. Don't worry. We don't worry. We start IV therapy and medications and like anti-emetic for vomiting. IV fluid replace your electrolyte imbalance mm, and anti-emetic control your vomiting. So don't worry, you will feel better soon.
Okay, what about this? I mean, how long will I be experiencing this?
Okay, don't worry. I know that you don't worry. You have um, you have been you have to stay hospital you for more day for this electrolyte balance and fluid balance for and vomiting. The medication we start and is work medicine to work mm, starting and working starting and then you feel more better and then we will discharge you. And according to our doctor, your health conditions is your health condition and your baby is healthy, healthy. So you will recover fully after a few days. Don't do it.
All right. The other parts, I mean, there are other tasks as well. Talk about husband until something's asked by the patient. No, no, I can hear you.
Sorry,
We can hear you.
unstable network.
We can hear you.
Yes, sir.
Okay, do the husband's part there. You know, who is here with you for emotional support?
Okay. I said that Mary, you have medications. You have medication. That medications will not harm your baby. So if not harm your baby, and if you have if you have
Yeah, yes, correct. The part so you can talk about the emotional support, you know, through the husband and everything. So no, I mean, the patient has not said anything. Well, you can of course express that, but you can talk about the husband now, where who is here with you and all those things. The husband part, yeah. I mean, who's here with you? Do you have any questions? This is the part that's called E4. You need to check with the patient if the patient has understood everything and if there's anything else the patient wants to ask. You have to start that.
Have you there any?
Has anybody what? Come on, I mean the husband part के. Who's here with you?
Sorry, sir. मेरो नेट हजुरको भोइस कट आइरहेछ कि त्यही भएर.
Oh, it's okay. I'll wait for you. No problem.
Have you any there?
Is there anybody here with you?
Is anybody there here for you?
Yes, my husband's here.
Okay. I will send your husband in there for your emotional support. Okay.
Mm-hmm.
If you have any problem, please feel free and please ask me.
Okay.
Okay. Thank
All
you
right.
for your concern.
Okay, so B1 is a shortage in your speaking. B1 is lacking. You need to ask few questions. B1 criteria, that means you need to construct few questions to show that you're curious about the patient. When did it start? How long has it been happening? Have you taken any medication? And all those questions you need to ask on purpose to make sure that you're paying attention to the patient's woes and patient's issues. Adding that. So again, you're doing it for the first time. Of course, it's all forgiven, no problem. What I want you to do now is those criteria that I pointed out yesterday. You have to completely memorize A1, A4, B1, B3, C2, E1, E4, and D2. Memorize them and try to incorporate into your speaking. Yeah, practice a lot. Since you girls are together, you can practice with each other. Yeah. Okay, not bad. Not bad. You're not doing bad. Any of you? A lot of practice is needed here. Yeah. Any questions that you guys have to ask, please feel free. I'm here. No? Okay. Let me give you the homework for tomorrow then. Yeah. How about you guys prepare the next card? That is we've been doing this one, right? Page 5. How about you guys do page 6? Prepare by yourself at home. You'll feel more confident if you prepare at home and practice with each other or record and then you practice with me. Let's do a few sessions like this so that you get into the loop. The letter that you're going to do next is going to be the next one from the PDF that I had sent. So yesterday's letter was of Shaw, right? What was the name? I forgot. Cindy Shaw. Yeah, Cindy Shaw. So how about you guys do? Okay. Okay. Yeah. This one, Annie Ellis, page 25. This one. Note it down, guys. Page 25, Annie Ellis. This one. And this is a unique letter. You need to learn this, and there's a very high chance that this kind of question is going to be asked in the coming exam. It's been a while. They haven't asked any discharge letter here in Nepal. So this one, page 25 and page 6 from yesterday's PDFs. Yeah. All right. Okay. You guys have a great evening. I'll talk to you soon. Please team up and practice. You guys are on this in the same boat. So sometimes you become a patient and somebody else will be patient for you. And that's how you keep preparing. Whatever you practice, you should try to record and then listen how you sound on the recording, and then you can self-evaluate. Yeah. And you'll also be practicing with me live all the time. All right. Okay, guys. Tomorrow there will be listening as well. We're also going to do listening. So get ready for that as well. Talk to you soon.